Welcome, everyone. This is our first of 5 meetings in this series, and we're going to be talking about why we are all meeting in just a minute. But first, we want to do some introductions and briefly go over the agenda so everyone knows what we're doing today. My name is Sarah Johnson, but you may also see emails coming from me as Sarah Harlow. I was recently married, so I'm in the name change transition. And I work with AdCare Educational Institute of Maine through the New England PTTC, and I'm helping to facilitate the next 5 meetings so that we can develop a really strong plan at all of your leadership. And we can do some introductions, and then I will share our agenda for today. So I'll turn it over to Liz if you want to introduce yourself.
Great. And in terms of introductions, what I was thinking today is that we could provide, if you wanted to say your name, if you'd like to share your pronouns, you're welcome to. And I was thinking we could talk, just share a little bit about your current connection to prevention work, and feel free to provide your experience in prevention as well. I think that's helpful for us all to hear. How we kind of come to this place. So feel free to take like a minute or two to really give a little introduction about yourself. So I can begin just to share first. Again, my name is Liz Blackwell Moore. I use she, her, or my pronouns are she, her. And I'm the Director of Public Health for Cumberland County Public Health Department currently. And I'm a member of the Maine Recovery Council, and have been given the opportunity to chair this work group. My current work is as a public health director is really in public health systems work, but I support a team of folks here at Cumberland County. We have a Maine Prevention Network grant in which we do some prevention across the county in tobacco and substance use prevention and healthy eating, active living. So I come to that work through I started my career as a case manager in a harm reduction organization. And I worked with folks who had HIV and also had a co-occurring or also were experiencing mental health issues and substance use disorder. And most of the time they came to our program experiencing homelessness. So we provided housing support and case management. So that's how I kind of entered into the field of behavioral health. And through that work really came to understand or see how many systems had harmed folks over the years, and really wanted to be a part of systems change work and really thinking about how can we create systems of healing instead of systems of harm. And I mean that broadly, systems, that could be family systems, but also school systems and criminal legal systems and health and human services systems. And so went back to public health school and then did 10 years of prevention work, substance use and prevention and behavioral health promotion at the Opportunity Alliance before I moved on to becoming a consultant for communities, really thinking about working in that space of having restorative, healing-centered approaches to public health problems. So I did that for 5 years, working with communities in Maine and in New England and some other parts of the country as well, which was really great because it helped me see all the possibilities of how we do this work, and that they're plentiful. And so then I've been here about 3 years doing this work and have been honored to be a part of the Maine Recovery Council. So I would love to open it up. I have a list of us, and so I'm just going to do it in alphabetical order. So Andrea, I was wondering if you might be able to share do your introduction.
Thanks, Liz. Can you hear me all right?
Yeah, we can.
I'm having some connectivity issues at my house, so I will go off camera after I'm done my intro. But thank you. I'm glad to be here. My name's Andrea Sockabason. I use she, her pronouns. I am Penobscot and Passamaquoddy, and I'm the Senior Director for the Center of Public Health at Wabanaki Public Health and Wellness. I've been with them for 7.5 years, doing prevention work in the public health setting. Prior to that, I was a youth director for the Penobscot Nation Youth Program, also doing prevention work with tribal youth for Penobscot Nation. I think that was it. So thank you for having me and happy to be here.
Awesome. Thank you, Andrea. How about Brendan?
Hi, everyone. So I'm Brendan Schaffler. I use he, him pronouns, and I am a program manager at Healthy Oxford Hills, which is kind of like a public health department at our local hospital. We're part of the Maine Health family. I've been there for about 11 years, and the majority of my time has been facilitating something called the Oxford County Wellness Collaborative, which is about convening partners who are invested in community health improvement in some way, shape, or form, and trying to support them in working together in a smarter, not harder fashion towards shared goals. Right now, my touch in the prevention world is I work under a couple of overdose prevention and response grants. I've worked closely with the Western Maine Addiction Recovery Initiative and the Hills Recovery Center. And yeah, most recently that work has looked like doing a lot of trainings for different organizations in the area that we are trying to build like a foundational understanding of substance use disorder as a disease, and then talking about stigma, harm reduction, ACEs and resilience, other risk and protective factors. And we do work with schools as well on student substance use prevention and wellness days. I think we've touched almost every district in our county that way. Yeah, and several other kind of touches in the prevention world as well, but I think those are probably the most significant here.
Wonderful. Thanks, Brendan. Let's see, Leanne.
Oh, great. I was like, isn't Haley, doesn't H come before L? But I'm
Oh,
not.
it does. We will also include those folks at the end who are our help, our administrative and coordination.
Oh, great. Okay, good. I was like, oh, I still have time. So I'm Leanne Dodge, she, her pronouns, and I'm the program director of SOPO Unite, all ages, all in. It's one of the drug-free community coalitions, and we're in our 8th year of our funding, and our focus on 0 to 18-year-olds so that they become healthy adults. And my office is here in South Portland High School, and school's out for summer. I'm so glad, but I do get lonely. And my prevention background really started at the college level. I was a hall director at the University of New Hampshire for 10 years when I first graduated from college. And that's where I kind of got my first sightings of substance use in youth and how it impacts all kinds of stuff. And but then I did some work with the New Hampshire Teen Institute and out of Concord, New Hampshire. And then I moved to Maine, and I have worked for AdCare where Sarah works. And I was a project officer for a 2-year grant. And I oversaw 9 coalitions across the state focused on alcohol and tobacco prevention for youth. And I got to work all the way here in South Portland. Was one of my first groups, one of the 9, and all the way to Fort Kent, Lubec, Philip Strong, Gardner, USM, like all over the place. And so it was just a great way to move to Maine and get to travel a lot. You know, you hear people go, I've never been above Bangor. So anyway, and then just I worked for the state doing prevention, kind of again, project officer stuff, and also worked at USM doing brief interventions with college students and ran a wellness center there for 8.5 years. And so then moved to this job, which Liz wrote the grant for us and really created our restorative policy, an athletic code that has now spread to many other states and communities. And it's like, I never dreamed of this. I didn't even know what that meant when I first started. And it's off to the races, and it's really awesome. So thank you, Liz, and thank you for inviting me to this group. And I will stop talking.
Awesome. Nice to see you, Leanne. How about Madeline?
Hi, I'm part of SOPA Unite. I'm in 11th grade. I don't really have much experience. This is my first time being part of this type of prevention program. But like I said a second ago, I'm in SOPA Unite, so I know Leanne. And I've worked with her before, so I'm excited to work with everyone else. And yeah, I'm excited for this. Thank you.
Yeah, it's great to have you. And we'll pull out of you, Madeline, all the things that you have done in prevention, because we do know you've been a part of lots of things in SOFO Unite, and the transportation work that you're doing has been incredible. So we'll have other opportunities to hear from you and for you to provide some of your insights. So how about Mateo?
Hi, I'm Mateo. I use he, him pronouns. I'm a member of the Kennebec County Youth Advisory Board, where a youth advisory board run by the HCCA, so where April works. And basically, we're a prevention and like mental health board. So we strive to see a day where substance use isn't a thing, and we better mental health. We work just in Kennebec County, and the experience that I have, like I said, we do a lot of prevention work. So we make a lot of different rat cards and stuff like that. We do a lot of tabling, and I was also a outreach intern for Flavors Like Maine Kids, where we attempted to end the sale of flavored tobacco products this year. We we didn't get as far as we'd like to, but we're hoping to look back and go again next year. So yeah.
Wonderful. Thank you, Mateo. Welcome, Amran. Nice to see you. We're just doing some introductions. And essentially, we're just introducing ourselves, sharing your pronouns if you'd like, and your current connection to prevention work and and any experience you have in prevention. So we'll have Melissa go next, so you can hear from Melissa.
No pressure as the example. Thanks,
Right.
Liz. It's so lovely to be part of this group and to see new faces and to see faces that I'm very fond of. So very excited to be part of this group and to learn alongside you all. My name is Melissa Hackett. I use she, her pronouns. I wear several hats, as I think many of us do. I'm a policy associate with the Maine Children's Alliance, so I do a lot of state level policy advocacy work. I'm also the coordinator for the Maine Child Welfare Action Network. And a lot of my policy really focuses on child health and safety and family well-being. And I've been in this role for 6 years now. And doing this work, I started really kind of deep in the deep end of child welfare system involvement. And as I've worked with more families and talked to youth that are impacted by the foster care system, I've just become really passionate about being upstream in the prevention space and really understanding the conditions in the community and the family that really create challenges to child safety and family well-being. I got my MPH from UNE just this past year. So very excited to really take this population level public health approach to how we understand the challenges that families are facing and that young people are facing within those contexts. I'm looking at my notes to see if I said everything. I think in particular, I would just note for this group that, substance use disorder, parental substance use disorder is a significant driving factor in child welfare system involvement in our state. That's true nationally, but Maine tends to be higher in that respect. So really thinking about whole family approaches, 2-generation approaches to really interrupting cycles of trauma for families. So that's enough of me talking. I could probably talk about this all day. I'm very excited to learn alongside you all and hear more from you.
Awesome. Thanks, Melissa. I see that Jamie's joined us too, and we're trying to get April in. April's as an attendee, so we're trying to get you in. And I just will say we're just doing some introductions, and I apologize to any of you who are confused as to where to go. So we will next time make sure that the links, essentially you get your own special link that you have to use, or do the general link, and then that we can upgrade you to a panelist. So I apologize to anyone who is stuck in some other Zoom link world. We'll make sure to have those corrected next time. So we're just doing, we're doing introductions, and how about we'll just, we're sharing our names and our pronouns if you'd like, and your current connection to prevention work or your experience in prevention. So Amran, would you like to share?
Yes. Hi, everybody. My name is Amran. I'm the executive director of Generational North, which is a nonprofit organization. Oh, my pronouns are she, her, and hers. Sorry. And I'm the executive director of Generational North, which is a nonprofit organization that works with the immigrant and BIPOC community around substance use disorder and mental health. First and foremost, destigmatizing the conversation, but then also getting culturally competent resources within the community. So I think that's my connection to prevention. Because growing up in Maine, I realized that, especially within like the BIPOC community I'm from, the Somali community and a lot of people, a lot of youth were talking about substance use disorder or mental health within this space. And if you don't talk about it, how are you able to get resources within your community, but also if you're not getting those resources culturally competently, how are you able to get helped and how are you able to get those connections within these spaces? And when someone is struggling, it was very much brushed under the rug and nobody was talking about it. But then also a lot of youth who are struggling with mental health, I think mental health and substance use disorder definitely do go hand in hand. And a lot of people who struggle with mental health, they don't get these resources, and it's very easy to find different coping mechanisms, and sometimes those are substances, especially when it comes to youth. So finding ways to prevent people from using substances, but also prevent, the school to prison pipeline, making sure that youth, especially youth of color, have resources and connections available for them to exceed and excel. Because growing up in a space where you don't see a lot of people that look like you who are excelling and doing well, and there's also like only like certain lanes that you're like looked at that you're only equipped to do, and you're not looked at as like equal to your counterparts or your peers. We're trying to stop that and make sure that all youth have the accessibility, but also the tools to be uplifted and excel within their communities, so they're not using different coping mechanisms that do make it so they struggle, and making sure that they have people around them that look like them that are cheering them on and making sure that they do well within their communities. Because if we don't help them now and we don't start uh, giving them resources, then like our youth are our future, and we're just gonna, not have a future at the end of the day. So that's a lot of the work that I do. But yeah, sorry, I
Great.
could go on a tangent.
No, it's great. Thank you. Thank you so much. Jamie.
Hi, my name is Jamie Comstock. I use she, her pronouns. I'm the health promotion manager at Bangor Public Health and Community Services. I have been working in prevention since 2007, so long time. And working in the public health model of prevention. So working to change policy systems and environments. I'm a certified prevention specialist. And I also am the stakeholder representative, the prevention stakeholder representative for the Substance Use Disorder Services Commission. I recently was appointed to be a public health stakeholder for the Office of Cannabis Policies, Cannabis Hospitality Task Force, I think. So I've been doing this a long time. I come from a family of generational substance use. So this work is close to my heart. I am happy to meet you all, and I am excited to move forward with our work.
Awesome. Thanks, Jamie. And April.
Hi, good timing. My internet keeps going.
Oh, no.
No, it's okay, going out and in. So I'm probably going to come on and off camera depending on that. Let me tell you, it's been a morning, but it's okay.
Aw.
It's part of living, part of living in the boonies of Maine. My name is April Hughes. I use she, her pronouns, and I work at Healthy Communities of the Capital Area. And I just want to say it's exciting to see Mateo here. It's good to see young people involved in prevention. I am the Tobacco and Substance Use Prevention Coordinator at Healthy Communities of the Capital Area. And I have been in this field for about 7 years now, so I'm still fairly new in comparison to a lot of the amazing folks that I have been meeting, which is amazing. But I also lead the LGBTQ plus Support Me Network, which is a statewide network of prevention professionals across the state, really looking at prioritizing LGBTQ plus youth and young adults in the prevention field. And I will say that I'm also very passionate about connecting with young people like, Mateo, and I think it's Madeline Leanne, that's also joining us, especially around a lot of advocacy efforts related to tobacco and substance use prevention, because really young people can generate a lot of change. And so that's very exciting to see our younger generation of folks really joining a lot of these spaces. And I'm really excited to take my experience as part of the Support Me Network and with youth advocacy and see what we can do to generate change and prevention here in Maine.
Awesome.
And hopefully I've hit all the areas. I apologize.
You did. It's great. No, it's awesome. And then we have some support staff here. So Haley, would you like to introduce yourself?
Hi everybody, sorry I'm not feeling well, so I've been keeping my camera off. I work with the Recovery Council on their administrative needs. I work for the Attorney General's Office in Consumer Protection. I'm here if you ever have questions about administrative needs before the meetings.
Thanks, Haley. And Mary.
Hello, everyone. It's nice to meet you and hear a little bit more about you. I'm Mary Coyne. I use she, her pronouns, and I am the coordinator for the Recovery Council. So I oversee most of the processes that the council undertakes, including the grant process and the development of priority areas for that, which was in large part why this group was convened. So my role here is to help in any way that I can. And if there's also specific questions around what the council can and can't do, what maybe our processes look like, I'm happy to answer any of those. And also if there's any information, that I can relay to the full council that would help you all in doing your work and helping to identify our prevention priorities, please just let me know.
Wonderful. Great. So Sarah, did you want to share the agenda?
Yes, let me pull that right up.
I know you all received the agenda, so. So yeah, I thought we would just do a little time. We talk a little bit about some community agreements. And I will say that this first meeting, I do anticipate speaking more than I hope to in the future. But I feel like this is kind of like like a little bit of orienting us to the work of the council, the charge that we have as a work group, and then wanted to share a little bit about some prevention approaches, and give some time for you all to share some approaches that have been working in your community. We'll have lots of time where I'm really just facilitating and not sharing, not talking. So I just, does anyone have any questions about the agenda or any additional thoughts? Okay. And it looks like Sarah just put it in the chat for us. So I think I'm going to share my screen for a moment. Let's see, hold on just a second. And start with some community agreements. So one of the things we've been charged to have, this work group, but we do not necessarily have to do everything the same because as the council. So the council uses Robert's Rules of Order, and I have a hard time with it, and I don't know that it's necessary for our group to function in that way. So I guess I'm proposing that we create some community agreements on how we are. I see a thumbs up. So on how we are, and I have a couple that we've worked through here, and I just feel like it's nice to have a starting point, and we can scratch them, edit them, add. But I just wanted to provide sort of like a starting point on some agreements that I think will help us to be able to be here and in kind of agreement and moving forward without having to necessarily use Robert's rules. So being curious, open and respectful, honoring complexity and the fact that as individuals, we don't know it all, but collectively we know a lot. taking care of ourselves and each other. So if that means getting up for movement breaks, if that means eating, if that means supporting one another when somebody feels like maybe they're not being heard, saying like, hey, I see so-and-so is trying to say something, you know, like doing that. Listening for understanding, not disagreement, taking space and making space, and bringing a spirit of creativity and collaboration. These are just a starting point. I really want to offer you all a moment to think about these, provide additions or edits. Like, I don't really like that one. Or ones you use in your meetings. Brendan.
So we often use one around confidentiality that I like, which is take the wisdom, leave the knowledge, right? Like often when we're speaking from the heart, we're speaking about things that may be vulnerable or maybe just really personal. So how do we learn from one another in taking kind of the wisdom from that conversation, but leaving behind the details and not sharing anybody else's stuff unless you had very explicit permission to share that way?
It's funny because that actually is on ours, and I took it off, Brendan, because these are public meetings. And so we can still, if folks want to leave it on, we can, but that is a part of this, is that they are public meetings and are recorded and will be online. So I didn't want to create the illusion that there is confidentiality, because there really won't be. So I don't know if you have thoughts on that, given that these will be videoed and posted online.
I appreciate that reminder, and that definitely, right, will temper, I think, what I say.
Mm-hmm. Other folks have thoughts? Melissa?
I appreciate what Brendan was sharing and how you responded, Liz, and I think that's an important reminder to everybody that these are publicly available sessions. I still think that there's something there about sensitivity to the information that people are sharing. You know, I support a lot of parents who go and testify at the legislature, and that's also publicly available after the fact, but not everybody might find it their way to it. So how do I just sort of hold that in my own personal conversations with other people? I don't know if I articulated what it could be, but I think it's maybe just sort of like a sensitivity to, you know, at least as members, keeping what's shared in the meeting in the meeting.
Great. I'm just adding, I probably shouldn't do that, stopping the screen share. That's really annoying. Sorry. Because now I gotta, so I added, I mean, I appreciated the way you said it, take the wisdom, leave the knowledge. April.
Yeah, thank you. And I think another thing to think about, you know, as folks join in or listen in, or like considering the different levels of experience within the work group itself, just really, and of course, you know, especially in public health or prevention, we use a lot of acronyms or terms that folks may not necessarily fully understand. I think it might be helpful that, you know, if we're about to use an acronym or we say one or we use a term that maybe folks may not understand, that we try to provide a definition or explanation as we move through that. Because I found myself, you know, trying to explain what we do, but I realize I'm using risk and protective factors, or, you know, ASAP or this and this. And then people are like, wait, what are you talking about? And so I just feel like as we move forward, just being able to maybe check in with one another, be like, oh, great, you mentioned that acronym. You're right. Could you just let folks know what that means? Or just check in with one another as we use language that like folks in this field use, like it's second nature, but that we're at least defining it.
Oh, look at that, it's showing up. How does, do you have a use language for all? And
yeah, yeah, maybe just say, yeah, maybe, yeah, that's a good help. Yeah, help each other be mindful of jargon. Brendan, thank you for that. I think that's great.
Great.
I love the way that's phrased too, because sometimes we don't even realize we're doing it. So if we can help each other with that.
Great. Other thoughts, additions, edits? When we're in person, I'll bring these so that they're on the wall, but perhaps we can also, Sarah, if you wouldn't mind, I can send them to, or I can put them in the chat. I feel like it's always just helpful to start meetings with this reminder, because then we can help remind each other as we go. I will put them in the chat. We can come back to this too next time and see if we have additions. I realize that there will be things I'll throw out today as like, what do you think about this? And it might take, not everybody, some folks need some time to consider things. And so we can return back to it if you feel like you still have things you want to say or additions you want to make. Great. So I thought we could move on, and I would give a little Maine Recovery Council overview, just so that we're kind of all on the same page with what's happened so far and where we're at, and what our kind of charge is as a work group. So please feel free to just stop and ask questions. Go off mute, ask me a question along the way, and I'll also leave some times at the end, but if you have a question right away, please feel free to ask. So the council was established in April of 2022 in a statute, and then by November of 2022, the 15 members were chosen and assembled. And the role of the council, really, as you know, is to disperse the opioid settlement funds for opioid abatement and to alleviate the impacts of harm caused by certain entities within the pharmaceutical supply chain. So there are ongoing settlements. They haven't all been settled. There are, I think, a few more that are in the pipeline. But so far, you can find a mountain of information on the Attorney General's office under opioids. If you look up opioids under the Maine Attorney General's office, and you can find all the documents related and which settlements have been, gone through. I can't keep them all straight, to be totally honest with you. If you want to know more, they're in there for sure. There's some good early, if you look at the Recovery Council calendar, early on, like in November and December of 2022, we got some good info from Brendan O'Neill, who will come to these meetings in the future, who's the Assistant Attorney General, who was a part of the settlements, part of the litigation. And he provided us with some good overviews of that. So you can find some of those in those early documents if you're curious. So in terms of the harm caused, I think we know it, we know it and we feel it, but I think I just want to say, of course, it's just been this monumental growth over the last, 2 decades, but especially in the last decade of overdoses and overdose deaths, and over almost 5,000 deaths by overdose. The overdoses by 100,000, you can see that it's impacting some parts of our state quite dramatically. But really, I think I just saw research that 2/3 of adults in the United States know somebody who has died of an overdose, which is a remarkable number. Unintentional injury, which includes overdoses, is the 4th leading cause of death by 2021. And then we saw some major changes, with the Good Samaritan law and Narcan really being dispersed super broadly across the state. And, we're able to see some declines in overdose deaths in 2023. But we certainly have a long, long ways to go. I do think it's kind of important just to share about the cost, the actual cost of the opioid epidemic, because I think it puts in perspective the amount of funding that the council has. And the CDC has done some estimates. There's some tools they've used to estimate the total cost of just opioid use disorder and opioid overdoses. And in Maine in 2020, the cost was $8.9 billion. And that's almost 400 million, 380 million in direct costs. So healthcare, substance use treatment, and the criminal legal system. But the indirect costs, that loss of productivity, loss of quality of life, loss of life, period, that is felt. I mean, 8.5 billion is just like an enormous number. I don't even know how to like hold that number in my mind, but I think we see that, right? Like we feel that, communities feel that acutely as loss of life and loss of security and safety. So I think it's just important as like a reminder of the just enormity of this problem. And you know, prevention actually wasn't calculated, which is classic, right? It wasn't even calculated in the direct costs, and it usually makes up about 1% to 2%. But we've estimated here that we think it's actually like 0.5% of the direct costs in Maine would be for prevention. So this opioid settlement, you know, the estimated total funding as of right now is 234 million over 17 years. So that is what like we have now, that there are still more settlements, as I said, but that have not come through yet, that are still in litigation or in agreement findings, you know. And the distribution of those funds, 20% goes directly to the Maine Attorney General. 30 goes to subdivisions, which are counties and towns. It's towns that were part of litigation and towns that have a population above 10,000. And then 50% goes to the Maine Recovery Council for the Recovery Council to disperse. So what that looks like in 2023, that meant the Attorney General had about 6 million and the Maine Recovery Council had about 14 million to give out in 2023. And then over the total of those 17 years, the council will have 117 million. And this will probably go up as we have interest on whatever we're saving and on any new settlements. There's a list of approved uses, and I highly recommend looking through it. It's again you can find it. I'll send this PowerPoint out, and you can find it on this link. And the approved uses are really for evidence-based or evidence-informed strategies in prevention, harm reduction, treatment, recovery. There's also some uses for coordination, leadership, and research that can be used. And I'll say it really is not supposed to be used for supplanting, right? It's supposed to be additive. Like, as I said, this problem is so massive. Whatever we're funding now, we need more, right? So like whatever is being funded, this is supposed to be additional. And so I think that's, for me, I feel like I want to remind people that. This is not like, no, we're not going to fund you anymore. Go seek funding from the Recovery Council. The idea is like, it's supposed to be that we get more because this problem is it requires that of us. In terms of the funding, does anyone have any questions? I mean, I don't know that I can answer them all, but this is sort of where we're at with funding.
I do, Liz. Like, what is how is the Attorney General approaching their allotment of this?
That is a question
Yeah.
I can't actually answer myself. I'm not totally sure. I have some slides later where I'll show you what some of the subdivisions are spending their funding on. I'm actually not sure I am about that, but we can find out and ask what's been that funding has gone for.
Sure, thanks. Not a big deal, just wondering.
Yeah. No, great, good question. So in terms of the structure of the council, there are 15 members. They were appointed by different folks within the legislature and the government. And then there are, as you met Mary, she's our contracted staff coordinator for the group. You can find the whole list of members online again in that on the Maine AG's opioid section of his website. Right away, the council approved this principles for use of the settlement funds that Johns Hopkins School of Public Health had put together. And those principles are essentially to spend money to save lives, use evidence to guide spending, invest in youth prevention, focus on racial equity, and develop a fair and transparent process for deciding where to spend the funding. So these are the guiding principles for the council. And so, you know, I think for us, there's many things in here that are important for this prevention work as well. And I am, you know, think the council in general has been really interested in funding prevention as much as any of the other pillars. So I think we're trying to work through all of these, right? So this will keep that in mind as we do our work as well, to hold these principles as we're doing our work. So in terms of some of the activities of the council, I thought it would be helpful for you all just to see some of the things that's been done so far. In the beginning, there was really a lot of, you know, this is a totally new entity. And so with a new entity, like a new quasi-governmental entity, there's been a lot of trying to figure out how do we organize and create work groups, work on the bylaws, developing a process for giving out the funding, conflict of interest, learning about what's already being funded or not funded and what are the gaps. It was a massive learning curve and just structural, trying to create a whole structure for an organization in that first, you know, 6 months. In the summer and fall of last year, we held a public hearing and did a public survey. We hired a contractor to help us with some short-term priorities, and then hired Mary as our contracted coordinator. And then in December, we voted on some immediate funding to efforts in each of the pillars. And I wanted to share with you a couple survey highlights because I think these are interesting for us to know about. There were, in the end, there were actually over 600 respondents, but here from this, it's 568 respondents. All counties were represented, although it was more overrepresented in Cumberland County. There were people who were responding from all aspects of this problem: young people, people with lived experience or living experience, family and friends, people working in the field. And the top 3 priorities of all respondents were the supporting people in treatment and recovery, treat opioid and substance use disorders, and connect people who need support to the support they need. Those were the overarching priorities. And I'd say then this second tier priorities were really around preventing overdose death and preventing misuse of opioids and the development of substance use disorder. An interesting highlight that I wanted to share with you is that community conditions that negatively impact the problem, such as lack of affordable housing, discrimination, violence, food insecurity, lack of living wages, etc. This community conditions problem was identified as the greatest challenge to supporting people in treatment, treating OUD and SUD, preventing overdose death, and preventing misuse of opioids. So each one of these sections had various options to choose from of what is the greatest challenge to treatment, what is the greatest challenge to supporting people in treatment, what is the greatest challenge to preventing opioid misuse, and the number one choice was this community conditions. So I think that's like important to acknowledge here for us, because I think we see our work in that space, but I don't know that that doesn't always come up for folks when they think about what do we need to do to address this issue. Lack of funding or restrictive funding, lack of public understanding of the problem, stigma, those were other things that were also identified at lower levels. So the Recovery Council then in December, I said we allocated some funding, and I just wanted to share with you what we funded. So there were 1.5 million over 2 years that went to youth serving organizations. One of them, the Peter Alfond Foundation, that's doing a peer learning cohort for, I think it's 26 organizations across the state to really beef up their positive youth development and capacity to do the work at a higher level of youth engagement. And so they were funded, as was the Maine Youth Action Network's Maine Youth Leadership and Development Council, which again is also a group of organizations that are working on building their internal capacity to do this work at even at a more sustainable and higher level of effectiveness. And then 1.4 million over 2 years to provide flexible funding to families, most likely through CAP agencies and their parent programming. That's the whole family services contract. And so in terms of harm reduction, there was funds that were given to the SSPs, which are the certain service programs, harm reduction sites. And really it was to do whatever they needed, use the money in whatever way they felt like they needed it. There was some money set aside for detox. That has not all been figured out yet. The idea was that they would be in Androscoggin and Franklin County, but there's still conversation happening because it's really hard to start up detox centers. And so there's a lot of conversation happening about how do we keep doing that, increase the beds and sustain the ones that are there. And then there was money set aside for a new recovery community center in Piscataquis County. It was the only one that did not have a brick and mortar recovery center. So that's the funding allocation so far. This year, we're in the middle of developing contracts for all those awarded projects. They haven't all happened yet. It's like, again, like we're a startup organization, really. So creating contracts and all that's taken a long time. We released a letter of intent for an RFP process for projects around harm reduction, treatment, and recovery. And we're developing this work group. And this work group, will make recommendations, and an RFP or some other version of how do we fund whatever it is we're recommending will come out of this when we're complete. I wanted to just share with you really quickly what I know of some of the subdivisions, because just for your information. This is from 2022, so this is not accurate, but I just wanted to share with you kind of like the percentages, that what it looks like. So all 16 counties got funds, and then additional 23 towns are receiving opioid settlement funds. So when you look at Cumberland County, there are 9 towns and the county that all got funding. All together, it equals 1.6 million. The county didn't receive 1.6. We are receiving about 200 to 230,000 a year. But, City of Portland received a bunch of money, and then all these other smaller 8 other towns received funding. So you can see there's sort of like a real mix of what is happening across in terms of funding. I wanted to mention that the Wabanaki tribal nations may receive a small amount through a tribal opioid settlement, but are not funded directly through the Maine opioid settlement unless allocated funds through the Attorney General or the council or the subdivisions. I think that was just important. I wanted to make sure you all know that, that there has to be an allocation given in order for them to receive funds. In terms of some examples of projects, I put this together for another presentation. I'm not going to go through it all with you here, but I just feel like it's interesting to look at. Was collected by, a lot of this information was collected by Mary, asking the counties and the towns, what are they spending their money on? And so, hopefully it's mostly accurate. But there's a lot of funds you can see for behavioral health liaisons. A lot of folks are using funding for more on the treatment side. I would say there's very little so far in prevention, but we're hoping to, I think in some ways, we might have to support folks to understand what it is they could do in prevention, because these are counties and towns that haven't, we have the luxury of having a public health department within our county, but that's not true everywhere else. And so knowing what is possible in prevention may not be as easy to see as being able to see what you could be doing in the treatment and harm reduction recovery side. April, please.
Hi, so maybe this is a silly question, but this is actually very helpful to see what folks are going to be focusing on, but how do we, like, for the municipalities or locations that are receiving funds, how do we find out what they're being put towards. So we have Sagadahoc, Kennebunk, South Portland, different locations on here. And I know that Kennebec County is receiving some funds. How do we, or who do we contact to find out how those are being used?
I mean, you can connect with them directly and ask. I mean, I think this was collected from Mary. Mary reached out to all of them and asked them what they were using the money for. I think the Maine Monitor, they had an article in which they tried to get information from everybody and asked what people are using the money for. And put out an article. I don't know if you saw it. It was done. It was probably like a month ago. You can look it up. It was in the Portland Press Herald, but it's a Maine Monitor. It's Emily Bader. She's the one who writes a lot about this. And so she did a little piece on what people were spending the money on. So, I mean, that's my answer, I guess, is like, it's a hodgepodge answer. Like, you can call and ask, and you could put in, like, I don't think you need to put in a Freedom of Information request, because they will tell you. Most likely, like they will share. But that's, I think that's how, but Mary just asked. Mary, do you have anything you want to add?
Yeah, I'll just say, so my process for going about this was, well, my outreach happened at the start of the year. So over the past couple of months, the amount of funding that subdivisions have received could have changed. Also, the way that they intend to use the funding could also have changed. I plan to reach out to folks again by the end of the summer to get an update, but it's usually the county administrators or the sheriff's office who are most tuned into what the funding, well, if the funding has been received and what the plans are. I would say that overall, it seems like counties specifically are starting to get a little bit more momentum around how to spend the funds, and a couple of them have like formulated task groups or advisory groups to help create a spending plan. So it seems like, again, folks are using the money overall, and there's trends, I would say, for it, as Liz has presented here. But I'm happy to share with this group any updates that I have, again, towards the end of the summer.
Melissa.
Well, first of all, applause to Mary for pulling this together, because I've never seen all this information in one place in a nice visual way. So interesting to see how people are allocating priorities differently. I'm curious, and apologies if I knew this at one point, if the Recovery Council or the Attorney General provided beyond the sort of very technical information to counties and school administrative units about best practices in developing priorities for the spending. I'm curious if Maine is aware if other states have done something like that, just in terms of a lot of counties are not used to having this kind of money and knowing what to do with it. So I'm just curious if there have been any sort of guidance about best practice in developing priorities.
Yeah, Liz, I can jump in here if that's okay. Melissa, that's a great question. And the short answer is we have not published anything yet around sort of best practices or recommendations for how to use the funds. Other states have started to do that. And something that, I've been keeping track of as the council does its work, and also as I've communicated with the subdivisions, is trying to get a pulse on what sort of help we can provide, what exactly they're looking for and what stage they're at in their spending process. So once the grant application is finalized and we have that out, I've mentioned to the chair and have shared with the council as well that a lot of what I look forward to focusing on, and the council's sort of next priority, is looking at ways that we can support spending, in other parts of the state. And as Liz mentioned, this is funding that's supposed to supplement, not supplant, and it will have such a great impact on the state if we do this together and there's collaboration at play. So that is definitely something we'll focus on. And if also you hear anything or think of things that would be helpful, again, in terms of support, please let me know, because those are all things that we're starting to brainstorm.
Mm-hmm. Great. Yeah, and in Cumberland County, I reached out and have been in contact with the other towns and folks just to say, is there ways we could support you as a county public health? And mostly, there have been really some great conversations, and people are really interested in working together. So there's a real interest in making use of this funds as in the best way possible. And also pressure to do stuff like right away. So I think, it's 18 years. We've got a long, I think, people may change what they do with the money over time as they see different opportunities and different options for them.
Yeah, I'll just add one more thing too. I've heard from a couple folks that the council's grant opportunity has also started some discussions locally around how they plan to use the funds. And it seems like it's sort of been an impetus for starting conversations, if that hasn't happened already, around which organizations are planning to request funding, if there's partnership opportunities available. And so I'm excited to see sort of that momentum that will hopefully, continue to carry us as we figure out how to spend these funds.
I just wanted to quickly add that the MOU does have a transparency clause for the Recovery Council, which directs them to report and create a dashboard on how their funds are spent, but it doesn't direct the subdivisions to do that. So if you notice the difference between the finding information and how it's presented, that would be why.
Any other questions about the council? I'll jump into kind of like what's our charge and what we're doing here. But I'll leave a second. Any other questions?
Liz, I
Okay.
have a question.
Sure. Please go ahead.
About the composition of the council. Can you let me know how many of those 15 members have lived experience with substance use disorder?
I believe those who present as saying they are coming as people with lived or living experience, I believe there are 4 or 5. And then there are a few who are representing, there are 2 who are kind of coming as treatment providers. Well, 3 who are coming as treatment. Oh no, 4. So there's a lot of treatment providers. There are 1 or 2 that are deeply involved, 2 or 3 deeply involved in harm reduction. And I am the only prevention person, which is actually a great segue into, I'm the only prevention person. I'm the only person who is in public health on the council. So I think it leads us to this like sort of what is our charge here and what are we doing? And I think, do you have other thoughts on that, Brendan, before I jump into this? Is there something else you were interested in?
Yes, thank you very much.
Okay. I think that the goal of this work group really is to provide recommendations to the Maine Recovery Council on what those prevention funding priorities should be. Because folks on the council, there isn't like a whole cohort of folks who do prevention work. I think there was, and quite frankly, I think prevention, what we know to be kind of evidence-based practices in prevention isn't necessarily well known and well understood by folks kind of outside of our profession. As I think there's been a lot more momentum and movement on what is evidence-based treatment and harm reduction and recovery. Like that has come to be understood more deeply by a larger group of people. And so I think that we, I felt like as a council member, when folks were looking to create priorities for funding, in many ways, they were looking to me as the only prevention person saying, well, what do you think? And I felt like, well, I mean, I'm one person in prevention. Like there are many needs, and prevention is really complex, and we really need a whole bunch of strategies to happen. And so I think partly, my request to the council was, I think we should have a work group that can provide those recommendations to the council and like really get. So that's our charge, and that's what we're here for. And I was given the opportunity to chair this group. We are not a necessarily like a Maine Recovery Council. We aren't like necessarily embedded in the bylaws. We're essentially like an ad hoc work group we will together, me and you will be bringing to the council our recommendations. So in terms of the process that I've outlined, which I want to share with you, and you've seen it because I think I shared with you what I outlined, but I want to give us a moment to just say, like, are there other things we need to complete that goal? And I'm aware that I clearly cannot think of all the things. So I would love for your input here. So this is the, kickoff meeting. Our plan is for PTCC to present an assessment of the prevention funding that's happening in the state at the next meeting. So that helps us kind of understand, all of us get on the same page with what's being funded now and what isn't. And I would really like for us to have time for work group members to share what you think are some gaps and barriers, and particularly with populations of folks who have higher barriers to health and well-being or unique factors that need to be addressed. So in the next meeting is like a 3-hour meeting, and the purpose of that is so that we really get time to dig in on where are there gaps. And so I would like to invite each of you to think about, perhaps we each take 10 minutes to talk more deeply about what we see and what we think are the gaps that we've identified from our purview. Because I think this group has a really interesting, diverse outlook on the state. So I would love for us to share that in that second assessment meeting. And then we have 2 meetings in which we could be potentially talking about strategies, where we really think about using our assessment and all that we know. What do we think are some evidence-based or evidence-informed strategies that need to be added, that could have could be used to address those gaps and require more funding. I think we can hopefully lean on AdCare a little bit here too, to if there are ideas we have or things, they could perhaps do some background research for us, bring some of that, so that we can then move into our creating some final recommendations during the 5th meeting. And I guess I would suggest we use consensus to develop that final set of recommendations. We may not agree on all of them or the order, but my hope is that we can really build consensus on what we think what our recommendations will be. And then we'll be able to present to the full council at a meeting in the fall. So I'm wondering if people have thoughts of additions, changes, other things you feel like we might need to hear from in order to get to our goal of funding recommendations. You can also think on this one too and send me an email, because I know I'm throwing a lot at you to think about in short notice. And again, if you're a crockpot thinker, I'm happy to take that information at another time and add it in. Okay.
Liz, I like the idea of crockpot thinking. I'm going to take that with me in my life. I just want to say, like, from a high level, this makes sense to me, and I appreciate the outlining of that, so we can think ahead to future meetings and how we're going to sort of map this out.
Yeah.
But I will continue to crockpot on this.
Okay. Awesome.
This looks good to me from a high level, and one of the things I'm thinking of is how do we look to other places that have like promising programs, and maybe it's a little early for outcomes, but how do we learn from best practices elsewhere? I'm guessing that's going to come up in the meetings 3 and 4.
Yep.
But just wanted to name the need, the need I feel for that at least.
Totally. Great. That's awesome. Well, Sarah's taking notes. So Sarah.
Yes.
Thank you. Great. So with our last little bit of time here, I wanted to just lay out a little bit of some kind of bigger picture thoughts on prevention. And I know that all of you have like very deep knowledge about prevention. But I thought I would just sort of outline a little bit of foundation for viewers and the public about our prevention approaches. I think, as I said, I found that the science of prevention and kind of evidence-based practices are not as widely known as some of those other practices in the treatment and recovery and harm reduction space. And so it feels important for the public and for folks to kind of understand what our approaches are so that they understand where our recommendations are coming from. So I was just going to share a little bit about my thinking on prevention approaches, and with our time remaining, kind of welcome your thoughts on approaches that you think are working in your community. And then we'll have much more time in subsequent meetings for us to dig deeper into what's working and what's not working, because I realize we don't have a ton of time today. But I thought I'd just sort of share, I think this idea of prevention, we often think of it as like, it's the actual definition is the action of stopping something from happening or arising. And I actually think that we in prevention have, yes, that, but we actually as an entity, I think we've kind of understood that our vision for prevention is not just about stopping something from happening. It's actually much more about promotion of, we do now a lot of promotion work, right? Of like building healthier communities so that we stop something in the future. And so, I think our vision in many ways, a vision that collectively we hold, is that we want all young people to have opportunities for thriving. I heard it in your introductions, right? It's like about how do we have communities and young people that are thriving. And so our work in prevention, is to understand why and how something happens, but also what are the conditions that are best for keeping it from arising in the first place. And I always go back to the waterfall metaphor, which I'm sure everybody's sick and tired of, but in many ways, it's like, I think the waterfall metaphor being that, a community sees folks that are falling over the waterfall, and so they send a whole group of people down below to pull people out of the water. And then eventually they realize, like, wait a minute, why are people falling in the river in the first place? And they go upstream to really figure out what's going on up there. And I think, our understanding of what we should do upstream is shifting. And it's not just about standing at the edge saying, don't jump in the river. It's actually moving into community and saying, let's create conditions in which you don't even get close. Like, that's not even something that you're thinking about. And so, we think about the main risk factors for opioid use disorder. Those factors are, family history of addiction, a history of mental illness, early use of substances, and adverse community and childhood experiences, which we could call toxic stress or ACEs. That those really are the main risk factors for opioid use disorder. And then, of course, access to opioids then puts folks at greatest risk for really falling over the waterfall into opioid use disorder. When I think about these risk factors, I just want to share with folks that I think it's important for folks who don't know our work to understand that, this early use of substances is such a huge part of why we do, for opioid use disorder prevention, we do prevention of early use of any substance. Because, when prescribed an opioid by a doctor, a person with a prior substance use disorder was 28 times more likely to develop an opioid use disorder. The connection between substances is like massive. And we know that the earlier you use substances, the more likely you are to develop a substance use disorder later in life. And there was some research done more recently where they looked at basically every study that's been done. They did a meta-analysis of all the studies around the connection between adverse childhood experiences and opioid use disorder. And they just unequivocally found that higher levels of adverse childhood experiences is directly related to increased risk of opioid use disorder and opioid use disorder severity. So this connection is strong. And I will just say that I speak to this like kind of layers of toxic stress. So it's not just that folks have adverse childhood experiences, it's that when you have adverse childhood experiences, and you also live in a place that you're experiencing lots of community toxic stress, that makes adverse childhood experiences more likely to happen and people less likely to be resilient in the face of that struggle. When they have a household that they live in where they may be experiencing sexual or emotional abuse, or have a parent with a substance use disorder, and they live in a community that is able to hold them, right, and care for them and provide, support them in economic stability or food stability, and not discriminate against them, they have much more resilience then. So, I think we as a group of people in prevention, we think about these different layers, and that our work really is, we must have a whole community approach to deal with these roots of this problem. And that, I know all of us probably have a PowerPoint in which we show the sociological model, in which we understand that it's not just, we can't just do work with individuals, because individuals live and are impacted by the relationships they have, organizations they're a part of, the community, and the policies and systems. And so that our work is really in this whole community approach. I'm not going to go through all of these, but I know we all are working on some examples of kind of how we do our work that we will be sharing along the way, I'm sure. We can provide information and enhance skills and provide supports for positive youth development. But those things are kind of low-hanging fruit, right? They'll have some impact on individuals, and they're important. Information is important, and education is important, but it's not sufficient. And so these things kind of lead us to these strategies that are harder to do, but have a much greater impact on our whole community. And those are things like, reducing barriers and making sure people have those basic community conditions, changing consequences so people aren't ending up in the criminal legal system when they really belong in a place with more resources, for are having policies that don't that are most conducive to health and well-being. And then there are examples of reducing ACEs and increasing resilience. Resilience was, in that same meta-analysis, was found to be a major protective factor against developing opioid use disorder. And so there's work we can do in creating community environments that have social connection, more healing and trauma-informed communities, supporting parents and their economic stability, and then improving behavioral health supports for young people. We know if mental illness is a major risk factor, then we need to be preventing mental illness, right? So how do we do that as well? We can reduce ACEs and all those things, but we also could be doing some specific things to improve behavioral health supports and making sure they exist for young people, and parents and caregivers have what they need to be able to provide support to their young people who are using substances. So just want to mention that we also, I know as a group, we really think a lot about the differences, and that people may be at greater or lesser risk for substance use disorder depending on their individual family and community conditions. And that, discrimination, historical trauma, access to resources, housing, security, family context, all matters. And that we need to create and implement culturally relevant strategies to address these differences. And that we know what doesn't work in prevention. I'll just say there's a lot of really good research about what doesn't work. And I think it's important to remember that scare tactics and fact sheets and one-time assemblies are not effective, and that sometimes can actually be harmful. And while personal testimonies from folks in recovery or groups putting at-risk young people together may be strategies that work in early intervention and treatment, they aren't really as effective for universal prevention. And these things it's that we want to do what's most effective, right? And they don't work because it really has to do with brain development. It's not just that, because they might work for adults, but they don't work for young people, because young people, their brains are still developing, and sense of risk and reward is totally different from our own. They have a different, they're weighing those things much differently. And their sense of, they usually downplay the risks and they think that the rewards are much greater than they actually are. And that's really a part of their brain development. And so you throw in some scare tactics and they get into denial, they numb, avoidance of this. They don't think those things will happen to them. They have amazing levels of skepticism. Maybe we'll see that from our own young people who are here, which I love about being with young people, is that they question whether what we think is true, and why is that? And we have to think about, maybe it's not true anymore, right? So they have a good amount of skepticism, which is healthy. They also may see some of these things as being fun, where we see major risk. They see, ooh, that's fun. And that inflates perception that all young people are using. So it's important for, I think, our folks out there to remember why we don't do some of these things. So I know we don't have much time left, but we do have our 10 minutes here. And I'm wondering if some of you might be willing to share some approaches that, some examples, or you could build off of any of the examples here to tell us some of the approaches that you see that are working in your community.
I'll talk fast, but I just want to point out Madeline's on here, and she's been part of a small group of our SOPA Unite students that have worked to really assess the transportation here in South Portland and how to improve it for young people. And she's met many times with a student group and then presented to like all the big wigs in the city. And Liz was there too. And we've been getting emails, Madeline, just so you know, from the people who attended, who are like overwhelmed with gratitude and were so impressed by all the students and giving their feedback. And, so I just got a chill talking about it, that a small group of students might improve transportation, which might go like, what does that have to do with prevention? Well, if you can't get to these healthy places, then it's not good. So I just want to shout that out, that that's a big thing. And then our big thing we've been working on this whole time is on restorative policy and practice and not suspending students or kicking them off an athletic team permanently. And we've seen really positive impacts of doing that, and to be able to intervene with young folks who have been using maybe during COVID in 7th grade, and now they can't stop vaping. We could do My Life, My Quit or expel them. Which one do you think would work? So I will stop, but those things have been and we passed the flavor ban in South Portland, and we've seen kids who have start quitting now because they can't have access to it. And they've come to our social workers like, it's not worth it anymore. My supplier's charging me more. So these changes really do impact not just kids who haven't started yet, but those who have and want to turn things around.
That's awesome. Thank you. Mateo.
I think something that's worked for me and my conversations when talking about like prevention is starting a conversation about it, but then continuing to talk to that person individually about that. I think in a big group setting, it's hard to like fully address everyone. So smaller groups tend to work better for when I like am, talking about prevention, or when I was doing my outreach for Flavors of Maine Kids, stuff like that. Those smaller groups or one-on-one individuals, then they can go and talk to their friends, and then it's kind of like a ripple effect, which worked best for me when doing my prevention work.
Awesome. Thank you. Brendan.
Thanks, Liz. And right, I was thinking this question is a little difficult to answer, only because when you get upstream, I think it takes a while sometimes to see the effects. But one of the things that I think is working well, just judging by the response and what folks are hearing, is that our recovery centers in Oxford County are doing great work working with schools to provide support, not only for young people who are in active use, but a lot of affected others. It's a huge population, and I think that they're really, really appreciated. I know that there are sometimes there are waits to connect with staff from those recovery centers within some of our high schools. And just making those connections and providing support to them while they're an affected other and before they might be, changing their behavior into active use, I think is tremendously important.
Awesome. Thank you. Others have some thoughts? Yeah, April.
Yeah, and I just think, just working with the community in general in unique and innovative ways. I know, Mateo, thank you for so much for speaking up, but I know that with the groups that we've been working with, especially with young people, let me tell you, if you really want to find a way to like dig into the community and address like a lot of these issues together, the best people to tap into, I'm telling you, are the young people. Because I think Mateo would agree, we have so much fun just tossing ideas around with individuals and putting out surveys to get feedback about what our communities would like to see and do. And that's from the perspective of young people, but also individuals who work directly with them or with a lot of these issues in general. So for example, I know this past spring, we put on a youth mental health awareness art walk because we heard that a lot of people want opportunities to engage in the arts because they use that as a form of prevention. Because what we're seeing and hearing from young people and from the community in general is that when you're feeling really poorly or badly, especially when we look at a lot of the mental health issues that are rising within a lot of the communities, people are looking for things that make them feel good right off the bat, And so we talked a lot about coping strategies and how we can promote that. And one common theme that we noticed was really trying to hone in on activities that folks can engage in that promote the arts in some way, whether that's art and music or anything that you find beneficial or helpful for your mental health, but also finding ways to pull the community into those spaces as well. So when we did our youth mental health art walk, we had all of the downtown businesses in Augusta promote artwork from youth in their windows because they wanted to find a way to show young people in the community that we care about you. Here's that connection. So how can we support you? And we had schools that participated and they're like, oh my gosh, yes, thank you for giving our young people an opportunity to share their feelings in this space. And we invited youth musicians and we all came together and it impacted hundreds of people. And it was a beautiful thing. And now, because it was so great and well received, we're going to do it every year. So it's like that, finding ways to bridge those connections between the community, the young people, the ones that work and support them together. So it's that take a village, mentality statement. Love that.
Awesome. Thank you. Madeline.
Kind of going on what April was saying, I think it's really, and what I was doing in transportation, bringing back third communities, like third places, and making school more like, I don't know, more interactive other than just school work, like clubs and stuff. From what I've seen in my life, like a lot of people that I know who deal with like abuse, like drug abuse, they're alone a lot. Like, they're in that more of like that isolation mindset. So I think bringing back like their spaces and making school more like interactive would be a really good way to start, not just to stop drug abuse, but in general, just making it happier, like mental health and stuff like that.
That's great. Thank you. Mateo.
Just to add on to what April said, like when we had submissions of that artwork, most of them were very dark and very like sad, and that shows like the state of mental health in which teenagers are currently in. And I think also like tapping into that mental health area would definitely, I definitely feel like it would have effects on prevention and.
Wonderful. Thank you. Melissa, I know I saw your hand up. I'd love to hear what you have to say.
Yeah, I just love what everybody's sharing. Thank you. And I guess I just wanted to say I really appreciate what I think others are sharing about. I think prevention, as a person doing this work, it sometimes feels kind of preachy. And so instead of talking about necessarily what we don't want to happen, really focusing on what we do want to see, right? So I really appreciated that in the slide deck and what others are sharing, like what are the positive things that we want to see for young people and for communities. And I just want to name what others are sharing in the chat, this idea of social connection. It's come up with so often with young people I work with and with parents and caregivers who are struggling with substance use, that I think is something we don't talk enough about, is like the lack of social connection. I could talk all day. I love all this conversation, and just underscore community conditions. I think also there's a tendency to silo funding streams, silo the work that we're doing, and to really look at what's really deeply underneath the things that are underneath all the different areas that we're working on that really
Mhm.
impact the ability to prevent those things from happening and to promote the things that we do want to see.
Yes, totally. That's great. I'm mindful of the time. So, Mateo, did you, oh, is your hand down? It's 1:30 and I want to just say, one, I just so appreciate you all being willing to be in this with me and with each other. And this is really exciting, and exciting to be doing this with you all. The next steps, as I said, I would love for you all to share a little bit about, in that needs assessment conversation. If you don't feel like you want to share, just let me know. Like if you don't need time on the agenda, but I was thinking that we would each take 5 to 10 minutes to just sort of share out, because I'd love for us to all hear from each other, because I think we have unique things to share. And so that will come out in the agenda. If you don't want that time, just let me know. And otherwise, I'll send this PowerPoint to you all for you to have. And the recording will go up on the website. You'll be able to link to it, to like a whole slew if you want to watch any of the other recordings that are there. So yeah, any other things before we close?
Hey Liz, will you just, oh, sorry.
No,
I
go
can't
ahead.
raise my hand when I'm the host, so I can never announce that I'm about to start talking. Will you just make sure I get a copy of the slides too, and I'll post them on the website next to the agenda? Thanks.
Of course, yeah.
I just wondered when the governor's opioid summit is this July, and if
Yeah.
people are going, and if there's anything we could do there, or I know it's a little last minute-y, but when is it? You know the date of it?
The
Okay,
25th of July.
And it's in Portland or Bangor or
It's in Auburn.
Auburn. Okay, cool.
Yeah, it's in
So
Auburn.
I think it'd be the more of us that can just be there would be groovy.
Yeah, totally.
If
I'm
possible.
presenting in the last slot
Oh,
on
good.
like the intersections in the continuum of care. Like how do we work in the intersections between prevention, harm reduction treatment, like
Which is an awesome presentation if you haven't ever seen it.
I mean, you all don't need this presentation, but anyway,
No, but it's
thank
good.
you.
It's
kind
a
of you.
good spot. Yeah, I
It's
love that.
conversational. There's room for, it's like a workshop.
Awesome.
Okay. Thanks y'all so much.
Thank
Really
you,
great to see you
Liz.
all.
Yes, thank you, Liz. Thank you.
All right.
See you all later.
See you in person.
Good weekend.
Yeah.
Thank you
Bye.
all.